Stop. Before you skip this video, let me ask you one important question. Have you ever felt short of breath, heard a whistling sound while breathing, or suddenly found it difficult to catch your breath? If your answer is yes, you could be ignoring the early warning signs of asthma, a disease that can become life-threatening if left untreated. In today's video, I'm going to reveal everything you need to know about asthma, from its hidden causes and early symptoms to the latest treatments, emergency warning signs, and simple daily habits that can help you breathe easier. Stay with me until the end, because one piece of information in this video could help you protect your lungs or even save someone's life. Let's get started. Hello everyone, I'm Dr. Faisal, and today we're going to talk about a disease that affects millions of people around the world, asthma. If you've ever experienced sudden shortness of breath, wheezing, chest tightness, or a cough that gets worse at night, don't ignore these symptoms. They could be signs of asthma. Many people think asthma is just a breathing problem, but the truth is that it is a chronic inflammatory disease of the airways. It doesn't only affect your lungs during an attack. Even when you feel normal, inflammation can still be present inside your airways. Let me explain this in a simple way. This diagram shows your airways. Inflammation makes them swollen and narrow even if you don't feel it. Imagine your airways are like highways that carry air to your lungs. In a healthy person, these highways are wide open, allowing air to move freely. But in someone with asthma, three things happen. First, the lining of the airways becomes swollen because of inflammation. Second, the muscles around the airways tighten, making the passages much narrower. Third, the body produces extra mucus, which further blocks the flow of air. When these three problems occur together, breathing becomes difficult. This is what we call an asthma attack. Now, one important question many patients ask me is, Doctor, what actually causes asthma? The exact cause is still not fully understood, but we know several factors increase the risk. If asthma runs in your family, your chances are higher. People who suffer from allergies such as dust mites, pollen, pet dander, or mold are also more likely to develop asthma. Smoking is another major cause. Even if you don't smoke, breathing secondhand smoke can damage your airways. Air pollution, strong perfumes, chemical fumes, cold weather, viral infections like the flu, and even stress can trigger asthma symptoms. Another question I hear very often is, Doctor, how do I know if I have asthma? The most common symptoms include repeated coughing, wheezing, chest tightness, shortness of breath, and difficulty breathing after exercise or exposure to dust and smoke. These symptoms may come and go. Some people feel perfectly fine for weeks and then suddenly experience an asthma attack after exposure to a trigger. Let's talk about how doctors diagnose asthma. Diagnosis begins with your medical history. I ask patients when their symptoms started, what makes them worse, and whether anyone in the family has asthma or allergies. Then we perform a physical examination and listen to the lungs. One of the most important tests is called spirometry, which measures how well your lungs are working. Sometimes allergy tests or a peak flow test may also be recommended. Now let's discuss treatment. Many people believe asthma can be cured permanently. Unfortunately, there is no permanent cure yet. However, asthma can be controlled very effectively with the right treatment. There are two main types of inhalers. The first is a rescue inhaler. This works within minutes and is used during an asthma attack to quickly open the airways. The second is a controller inhaler. This reduces inflammation and helps prevent future attacks. It must be used regularly, even when you feel well. One mistake I often see is patients stopping their medication as soon as they start feeling better. Please don't do that. Always follow your doctor's instructions. Now let me share a few simple lifestyle tips that can make a big difference. Keep your home clean and free of dust. Avoid smoking and stay away from people who smoke. Wear a mask if you're exposed to pollution or strong chemicals. Exercise regularly if your doctor says it's safe. Maintain a healthy weight, drink plenty of water, and get enough sleep. A healthy diet rich in fruits, vegetables, whole grains, and omega-3 fatty acids may also support overall lung health. Finally, I want everyone to know the warning signs of a medical emergency. If you cannot speak because you're struggling to breathe, if your lips or fingertips turn blue, if your rescue inhaler is not helping, or if your breathing becomes extremely difficult, seek emergency medical care immediately. Thank you for watching, and I'll see you in the next video. Stay healthy and take care.